Could not prescribing exercise be medical malpractice when dealing with depression? This is a question that my guest today asked in a medical paper as well as answered. Hi, my name is Leah Mushid. I'm a reporter here at the Western Standard, and today I sat down with psychiatrist resident Dr. Nicholas Fabiano, who talked about how exercise has been consistently shown in studies to help reduce mild to moderate depression. Also, his answer to the question I said earlier may also help people understand how exercise can not only benefit depression, but can have a multi system benefit to the body. He elaborates further.
Yeah, so for a number of years now, there's hundreds of trials probably now looking at exercise as a treatment for depression. And there's been a number of meta-analysis, which is when you put all the studies together, both looking at exercise for depression, but also comparing it to the first line measures. So usually antidepressants or therapy. And they've consistently shown that exercise for mild to moderate depression has pretty equal effects to the first two or the therapy or medications, which is pretty powerful. And what made me want to write the piece about is it malpractice if we're not prescribing it is you can imagine if you have intervention that has equal effects to two of the other ones that we are solely prescribing in a simplistic sense. If you're choosing not or just not prescribing it because you don't know how to, being exercise, you can imagine that that might be an element of malpractice. The same way that if you went to your psychiatrist and said, or had symptoms of depression and said, I wanted to start an antidepressant, and they said, I don't know how to do that, you would probably be pretty shocked to hear that. And I think the same principle should apply to exercise.
Hmm. Okay, yeah. Um, then also, can you explore what are like because you said it was like a multi-system like benefit of exercise as well when it's prescribed for depression.
Mhm.
Depression, so like what are also the other benefits that you could like list like most significant?
Yeah, so people with depression are have a burden of physical health problems more so than the general population or someone without depression. So whether it's heart problems, kidney problems, thyroid problems, anything you name, pretty much there's an association. And we know exercise has benefits beyond just the mental health benefit. And usually it's actually prescribed for non-mental health reasons. So things like weight, things like glycemic control or diabetes, even some cardiovascular conditions. Obviously, there's contraindications for some people that may be higher risk, but it can help with your heart. It can help with all these different organ systems in your body. And we know that, again, emphasizing people with depression are unfairly burdened by these conditions. So having an intervention that can tackle both makes a lot of sense.
Mm. Yeah, because I remember in the intro when I was reading it, it was like talking
Mhm.
about, yeah, like what you said, all the different like for example, weight can also be a problem. Yeah.
Mhm.
So I was like wondering, is it like so say you're like overweight or something, are you more likely to have depression or something like that? Or is it like, I don't know. Or is it like you say you're depressed and then you kind of like l lack motivation, so then it's a consequence of the depression.
Mhm.
You know what I mean?
Yeah, I'd say for most conditions, obesity included, it would be both ways. So someone who has obesity has a higher risk of developing depression, but in the same way, someone with depression also has a higher risk of developing obesity or worsening pre-existing obesity. So I think obviously there's exceptions to that rule, but for a lot of the conditions that you can imagine, it goes both ways. So one of the ones I cite is cardiac conditions. So whether that's a heart attack, whether that's heart failure, there's a lot of what we call bidirectional associations between the two. So depression being a risk factor for that, but also the cardiac conditions being a risk factor for depression. You can imagine someone after having a heart attack and maybe having some functional impairment after that would be at a higher risk of being depressed. And in the same way, someone with depression maybe isn't taking as best care of their physical health because of those amotivation, low energy, that it has implications on their cardiac health. And you can see that same principle can be applied for a lot of different conditions, including depression and other physical ailments.
Mm, okay, yeah. So I guess it's just like very connected both ways.
Mhm.
Makes sense. Um, okay, what else did I want to ask? Okay, yeah, you said so antidepressants and psychotherapy, which is usually prescribed for depression, where like
Mhm.
doesn't work in like 30 to 50% on average.
Mhm.
That's what you said.
Mhm.
Okay, good. So, exercise on the other hand, like how likely is there like has there been measurements to like how likely it'll like help and or how much as well?
Mhm. Yeah, it's hard to say exact numbers compared to the 30-50% quote for medications and therapy because we don't see it as used as often in the real world setting. But when we look at trials, we look at an important metric, which is the number needed to treat. So it's the number of people you need to treat to have that positive effect. For exercise, it's around only two, which in medicine, you don't get numbers that low. So essentially, the higher the number is, the worse, because you need to treat more people to get the intended benefit. With depression being two, that's pretty high. Antidepressants varies which one you're talking about. Sometimes it can be around four or five higher than that. So you can see how there's a little bit of a difference there. But we need more of the research kind of in the real world setting, seeing how people are doing and are they adhering to it. But it's quite impressive from that sense and seeing the small number of people that need to be treated to see that benefit versus other treatments.
Also, why do you think like exercise is not prescribed as much as it should be, like in your opinion? And like, is it because like well, I mean, there has obviously been research done, but like compared to like antidepressants and psychotherapy, which is like the majority of what's prescribed, is it just because there hasn't been as much done? Or like, yeah, what's up with that?
Yeah, I think educationally it's not emphasized as much. Like everyone knows common sense exercise is good for physical or mental health, but it's not taught as much in medical school residency as a primary modality. It is in our guidelines, but it's one thing to be in the guidelines and another for you to be able to feel well equipped to speak to a patient about it. So I think that's one of the reasons. I think in psychiatry we have a lot of emphasis on the brain and neurotransmitters and everything. So we get very fixated on the antidepressants and what they may or may not do versus exercise that has very similar effects to that, but it's not really taught that way. The other thing is, I think, in terms of barriers, we don't have direct referral pathways to get someone exercising. Like it's commonly people will say, just go outside and run. And people know that too. They don't need their doctor to tell them that. They need support to get that going, whether that be having a trainer, whether that be having some other sort of supervision during exercise or some clear guidance on what to do. I think that's lacking. And that's a systems issue too, where if I want to prescribe an antidepressant, I can either click a button or write it on a piece of paper and it's done. But if I want to prescribe someone exercise, I can't really do that. Like they have to go to the gym themselves, they have to go do all these different things. But it would be great if I could write something on a piece of paper. They have now a trainer that's paid for them by insurance or a gym membership that's paid for them by insurance, similar that a medication would be. And that be tackled the exact same way that the other first line treatments are. Because you can imagine if you're a provider, you would go the easiest route too, probably. You only have so much time to talk, so much time to do different things. So you're going to go with what's familiar with you, what you have an easy route to connect with, which is usually just medication first line. So not that medications are bad, there's totally a role for them. But I think if we have different first line treatments, they all should be equally available to people and not just have biases in terms of which ones might be a little bit more accessible because it's no surprise that that's the one that's going to be used more.
Hmm. Okay. Yeah, that makes sense. Then I guess I'm kind of curious about this as well. So, say you were to like prescribe exercise, like would it be like the first thing you prescribe prior to antidepressants and like psychotherapy, or like would it be like a combination, or does it depend on the person?
Yeah, so it totally depends. Like the literature shows that exercise can be used as a monotherapy for depression. So monotherapy meaning the sole intervention. However, it can also be used paired with these other agents, or it can be used in a sequential sort of treatment. So say someone's really depressed, they have severe depression. It's probably not appropriate to use exercise first if they can't even get out of bed, sort of thing. But maybe starting an antidepressant medication first, even starting therapy or something, and as they're getting better, being able to incorporate some of those other modalities. So it's very patient dependent. There's not necessarily a specific patient that will benefit the best. We know
Mhm.
that most of the literature is in mild or moderate depression just because of those barriers that exist in severe depression. But that doesn't preclude being able to introduce it at a later time simultaneously with other treatments. Like there's a lot of different ways to combine it, but I think sometimes people function in the camp that it has to be one or the other. You're either lifestyle or you're either medications or therapy. But the reality is you should do whatever works best for you. And sometimes that's all of them.
Hmm. Okay. Yeah, that makes sense. I also was wondering, uh,
Hmm.
so like we talked like lots about like the physical effects and stuff like that, but I
Hmm.
also was thinking like maybe it's also helpful because like I guess since like depression is kind of like a very helpless kind of feeling, wouldn't it
Hmm.
be because as well like exercise is a very active thing where it's like kind of a control type thing where it's giving you more control over kind of your at least the feeling of like your actions and stuff like that.
Hmm.
would that be a contributing factor?
Yeah, like there's an element of maybe not the depression itself, but people describe with antidepressants, sometimes they feel that they need something to feel normal, which is not necessarily the case. But with exercise, what we say is it gives you the locus of control. So when you're choosing to exercise every day, choosing to do all these different things, it makes sometimes the patient feel that they're in charge of their recovery versus sometimes, and therapy can be the same for two, but sometimes with medications, it can feel the opposite where you're more dependent on something, which isn't entirely the case. But
Mm.
I think it for people when they think about these things, it is helpful to get the momentum going and say, I'm in charge of my treatment right now. It's not necessarily my fault that I have depression, but I'm in charge of getting out of this. And each day that I go for a run, each day I spend some time at the gym, I'm helping myself get out of that, which can be a very powerful mindset for people to have. So I think that is part of it. It's hard to measure that, but that's something that's been reported before in the literature as well too.
Mm. Oh, and like also because I feel like depression can also be very isolating. So
Mhm.
maybe as well, like going to the gym as well, like you're going into like a social environment, maybe even just being
Mhm.
around people could be helpful.
Mhm. Yeah, and I think that's one of the parts of exercise that we don't give full credit is the social aspect, especially for people that are more isolated. So a lot of the elderly population, specifically during COVID times, where maybe people weren't going out as much, they weren't seeing their family. This may be the only time where they did have some sort of an outing where they were able to connect with people or socialize. And we know even if you remove the exercise part and you just have the social part, that also has very important health effects for both your mental and physical
Mm. Yeah. Okay. Well, that's
health.
it. So thank you very much.
There we go.
Yeah.
Yeah, of course. Thank you for having
Yeah.
me.
Oh yeah, no problem. And thanks for